Welcome to the Dubuque County media release regarding the first confirmed case of COVID-19 in Dubuque County. I would like to begin with introductions. I'm Patrice Lambert, the Executive Director with the Dubuque County Health Department. Behind me is the Dubuque County Board of Supervisors Chairperson, Dave Berger, the City of Dubuque Mayor, Roy D. Buell, the City of Dubuque Public Health Specialist, Mary Rose Corrigan, Dubuque Visiting Nurse Association Director, Stacy Killian, and our Dubuque County Emergency Management Director, Tom Berger. A case of the novel coronavirus COVID-19 has been confirmed in Dubuque County. According to the Iowa Department of Public Health, the individual is self-isolating at home. While this is Dubuque County's first case, it will not be the last, and that's why we are encouraging all residents to continue to make prevention a priority. These actions will assist in flattening the curve so that all of our COVID-19 cases don't occur at once and overwhelm our healthcare system. The preventive steps include washing your hands frequently with soap and water for at least 20 seconds each time, covering coughs and sneezes with a tissue or elbow or upper arm, staying at home when ill, practicing social distancing by maintaining 6 feet of space from others. Approximately 80% of Iowans infected with COVID-19 will experience only mild to moderate illness. Most mild ill Iowans do not need to go to their healthcare provider or to be tested to confirm that they have COVID-19. Sick Iowans must stay at home and isolate themselves from others in their house. Stay home and isolate from others in the house until you have no fever for at least 72 hours. That is 3 full days of no fever without the use of medicine that reduces fevers, and other symptoms have improved. For example, when your cough or shortness of breath has improved, and at least 7 days have passed since your symptoms first have appeared. If you think you may need health care, call first. Your provider can assess whether you need to be seen in the office or if you can recover at home. There may also be options for you to talk with your medical provider at home by using technology. Our public health response team is working with the Iowa Department of Public Health daily. For up-to-date information on the COVID-19, visit the Iowa Department of Public Health webpage by Googling Iowa Department of Public Health COVID-19. For our county-wide messages, go to dubuquecounty.org, and for our City of Dubuque information, visit the website at cityofdubuque.org. Now I will turn it over to our Dubuque County Board of Supervisors Chair, Dave Berger, and then the City of Dubuque Mayor, Roy D. Buell.
Thank you, Patrice. First thing I want to express is that I have confidence in our public health incident management team. Patrice Lambert, the Dubuque County Health Department Executive Director, City of Dubuque Public Health Specialist, Mary Rose Corrigan, Dubuque Visiting Nurse Association Director, Stacy Killian, and Dubuque County Emergency Management Director, Tom Berger. I also want to introduce Dr. Bobby Canero, and he will be assisting our public health incident management team. As I said in our joint press release with the Dubuque, City of Dubuque and Dubuque County, Mayor Buell and myself last week, it is our personal responsibility to exercise social distancing and contribute to the community, state, and national effort to slow down the spread of the COVID-19 virus. This is a big deal, and your elected officials are taking it very seriously. Many of us saw on the national news over the last few days young folks partying on the beaches in big groups on spring break, and I saw one in particular interview that said, "It's okay, we're young." The problem with that is those young folks are going to return back home. They may visit Grandma and Grandpa in the nursing home, and we know what happened in the state of Washington, what's happening in Italy. It is a tragedy waiting to happen, so I can't express how serious this is. So with that, I'm going to turn it over to City of Dubuque Mayor Roy Buell.
Thank you, Dave. Good afternoon. As Mayor of Dubuque, I'm here on behalf of the Dubuque City Council and city staff to assure our residents that Dubuque City government has been preparing for today's confirmation of the presence of COVID-19 in Dubuque County. I'm sure I speak on behalf of all Dubuque County's city elected officials when I say we have the utmost confidence in the countywide response from the Dubuque County Public Health Incident Management Team, with support from the city and county staff as they continue their efforts to fight this pandemic. We are extremely fortunate that our public health and emergency management staff has been training for pandemic response for many years, and we are blessed to have the experienced staff and teams in place that we do. As I said last week, the number one priority of local government is public safety, and public health is public safety. While government and healthcare have obvious roles in responding to the COVID-19 outbreak, so does the public. COVID-19 is now confirmed in our county. Every single one of us now has the responsibility to do all we can to minimize the spread of the virus and flatten the curve. We must all limit our interactions outside the home and follow the directions from the governor and federal, state, and local public health officials. If you have questions about your social interactions, remember, when in doubt, don't go out. It does not hurt to be overcautious in this pandemic. If we all take responsible actions now, we can hopefully minimize the impact of this pandemic. Do not underestimate the seriousness of this situation, but do not panic. We are facing very challenging times ahead, but we are all in this together. Patrice?
Thank you, Board of Supervisor Chair Dave Berger and Dubuque Mayor Ray Boyle. So now we will open it up to questions.
I'm Fernando Garcia with KCRG. In terms of testing, is Dubuque County ready? Does it have any tests for coronavirus if more cases were to show up?
Okay, Mary Rose, would you like to address?
Mary Rose Corrigan, Public Health Specialist for the City of Dubuque. There's a couple factors regarding testing. The State Hygienic Lab is allotted so many tests, and they in turn spread those out over the state. So Dubuque primary care providers and hospitals do have some tests. Because of the limited supply, they have to use strict criteria on who they test based on the risks, such as travel, symptoms, etc. There are community primary care providers, the major ones, including both hospitals, Medical Associates, Grand River Medical Center, and Crescent Community Health Center, are planning for further plans for community testing once test kits become available. So those plans are underway right now and will be released when we're ready to go with that.
Thank you. Any other questions?
Ashley Scott from KWWL. So a lot of the concerns surrounding coronavirus, there has already been a mass amount of panic across the entire country, and of course specifically here in Dubuque County. Already stores are flying off the shelves with different types of supplies. Now that there is a confirmed case within Dubuque, how are you guys, what message do you want to send to residents to try to potentially ease their nerves now that there is a confirmed case here?
I can begin, and then others can join, but I would definitely say don't panic. We have easy preventive measures in place of what I had referred to of washing your hands for 20 seconds, covering your coughs and sneezes into tissue or your elbow, staying at home when ill. We cannot stress that enough, and practice social distancing by maintaining that 6 feet from others. We would also like to stress, when you look at the information, make sure it's from a credible source. Make sure it's from the Iowa Department of Public Health, the county website, or the city website. We know that a lot of misinformation is on other social media, and we just really stress to people, look at credible sites for the correct information. Anybody else want to address that?
As you answer questions, if you could repeat those questions.
Oh, I'm sorry. Sure. Okay.
I have a question. Could you explain how the test works?
Okay. The question is, how do the tests work? Mary Rose?
Well, logistically, I'll explain how the testing works. The primary care providers have the materials to take the specimen from the individual. It's usually a nose swab. They intend take that specimen and use a special kit and send it off to the state hygienic lab. We now also have the ability, or will be getting more ability, to send it to other labs who now have the testing ability. And we know that the testing is also changing in terms of methodology and the frequency, the quicker turnaround time. All those things are changing as new developments occur and as the tests are increased in supply. So the logistical issue is the primary care provider can take the specimen, and then that test has to be sent on to either the state hygienic lab or a reference lab. Local labs in communities do not have the ability to actually perform the actual laboratory tests themselves. There are a few universities that are doing that, but it is primarily state hygienic labs and national reference labs that have that ability right now. In the future, of course, we hope that all labs may have that ability. But this is not an uncommon practice as with other communicable diseases that we test for. We take the specimen locally. We may do an initial test, but often these have to be confirmed at state hygienic labs or other labs. So this is a typical process of how we deal with other communicable diseases also. The question is, how long does the testing take? Once the laboratory gets the test, the actual test only takes about 3 hours. But how quickly we will get results depends on the volume of testing they're getting and how quick we get it to the labs. We have couriers set up to take those tests to the labs. So it does depend on volume, how quickly we can get the turnaround. The Iowa Department of Public Health is releasing new numbers of positives on a daily basis. So when it's all said and done, those numbers are kind of compiled once a day as all those results come in.
I also have another testing-related question. Do we know how many tests are available within Dubuque County, and how are you prioritizing who gets tested?
The question is, how many tests are available within Dubuque County, and how do we prioritize? I don't know the exact number that's available in Dubuque County. We prioritize based on the travel history of that patient. If they were from a level 3 country, as the CDC lists, if they have contact with an current known positive COVID-19 person, and then there are some other factors. However, I would stress that these testing guidelines are changing as the availability of test kits change. So I think Patrice mentioned, and the governor just mentioned in her press conference, that we may not even be testing some people that are mildly ill because we want everybody that's sick to stay at home anyway. And this is, again, a typical thing that we do with other communicable diseases once it becomes prevalent in a community. We don't waste testing and laboratories' time on those activities when we assume. And as Dr. Pedati said today from the Iowa Department of Public Health, we wouldn't do anything different. If the symptoms for a cold are appearing, we would do the same kinds of precautions as if it was a mild COVID-19. We would say stay at home, take care of your symptoms, those kinds of things. If it gets worse, then you call your doctor. Thank you.
Can I ask, when are the extra kits planned to come to Dubuque County?
The question is, when are the extra testing kits planned to come to Dubuque County? We don't know that information yet, and I do not know. I don't believe the Iowa Department of Public Health knows that, or they haven't been able to tell us that.
Is there a fear of shortage of kits right now?
The question is there a fear of shortage of kits right now? I would say that, generally speaking, the people are concerned about that, and so is the healthcare community. We all wish we had more tests.
Yes.
So I know that in other places like Lynn County, they've been asking for people to donate like masks, gloves, other equipment that healthcare providers and people in the medical field might need to be testing people and to keep themselves safe. Is that the situation here in Dubuque as well? And if it is, like, do you know who, has anyone been donating already, or are you asking for those type of donations?
Okay, the question is regarding the personal protective equipment. If we're looking at having people donate and our supply, I'll refer that to Tom Berger.
Hello, Tom Berger, Dubuque County Emergency Management Coordinator. The state did put out recommendations for equipment that can be donated through the Emergency Management Agency. We do have a very limited supply right now, so that is a concern among our EMS folks that are out there. So we would take donations of the masks or other personal protective equipment and be prepared to distribute that amongst our first responders. So that's something that can be donated if it's good use and still pretty much in its package, and we can take that and reallocate it.
Another big concern amongst the public has been kind of the problem between HIPAA violations and patient privacy, which are very important, and of course public safety. Earlier this week, the Lynn County Public Health Board asked anyone visiting a particular restaurant on particular days to get themselves self-quarantine because the DJ did test positive for COVID-19. How are you guys trying to vary the level of public safety while also protecting these individuals because they're because of HIPAA?
Okay, the question was, with the HIPAA and confidentiality laws, how are we trying to protect the public? Stacy, would you like to?
Sure. In our county, the Dubuque Visiting Nurse Association does the communicable disease follow-up disease investigations, and we are not releasing any information regarding anyone who is a positive, any monitoring or any testing that has been done, including isolation. So we are keeping that information to ourselves, and we are continually explaining to the community that you need to wash your hands, you need to practice your social distancing, all the things that would keep yourself safe as well.
Just a follow-up. In a hypothetical situation like that, though, if there is someone who may have been exposed to a mass amount of people at one time, could we see a similar statement coming out to Dubuque County?
So the question was, in a hypothetical, if we were to see a mass amount of people in a situation similar to that, would we see anything come out from Dubuque County? And the answer would be no. Any information would come out through Iowa Department of Public Health, which is who we defer to. I can assure you that whenever we do any disease follow-up or investigation, every disease has its own follow-up and investigation depending on what that disease is, and that includes investigating who those people were around, whether or not it poses a higher risk to them, and at that point, at the recommendation of Iowa Department of Public Health, we would increase testing or call those people in. So you can assure that we are doing that. So if there is a positive and there has been any exposure in the community, our nurses are really following up on that and doing what is recommended by the state.
Any other questions?
What facilities, clinics, and hospitals currently have the ability to test?
Mary Rose, would you like to take that? Do you want to repeat the question? Okay.
The question is about what facilities currently have the ability to test. Mercy One, Unity Point Finley, Grand River Medical Group, Medical Associates are the primary providers that have the ability to obtain the specimen and send it off to a reference lab at this point. Other primary care providers are referring to these facilities for testing of their clients. And there may be others adding on as they contract with reference labs, et cetera, that provide the testing.
Those hospitals that take in cases, are they currently dealing with an influx of patients walking in wanting to get tested, or are they dealing with just more patients than usual, either just coming in or calling the hospital?
The question is how the hospitals are dealing with all of potential increased patients, et cetera. One thing I can assure you, as we and our public health incident management team are in regular communication with our hospitals, that both Mercy One and Finley, Unity Point Finley, are in full emergency operation mode. They have been planning for this for years, as we all have, planning for a pandemic, and they are prepared. They have their surge plans in place. They are mitigating exposure, both with their staff and patients and the public. They have extremely limited visitors to only critical people that need to be in. They have personal protective equipment, but they are doing preservation with that personal protective equipment and using it widely. They are postponing some elective procedures, I believe starting tomorrow. Some of the primary care providers are also postponing non-essential appointments and visits. Both hospitals are focusing on patient placement within the hospital. They're assessing their ventilator capacity, their personal protective equipment in each phase of this patient placement plan. They have fully focused on containment and preparation. So, and incidentally, on a just normal basis, the hospitals routinely report the number of beds they have open to the Iowa Department of Public Health. So that's a system we have in place to assess and evaluate our overall state's capacity for hospitalizations.
Any other questions? Okay. Does anyone behind me have any other further comments? Okay. So in closing, please remember that this is a rapidly changing event. Please make prevention a priority. These are sacrifices that we must make if we want to limit the spread of the COVID-19. We all have many loved ones and those around us who could get sick, become hospitalized, or even die from the COVID-19 virus. So please, institute and follow those preventive steps. Thank you very much.